Bonjour, Moni, Greg Nadjiwon. We're doing this video this afternoon from our Madoki Center, Elder Center, and we're privileged to have a special guest here this afternoon, the medical doctor of the area, Dr. Arra, who we're very, very privileged to have with us this afternoon. We've been working with the doctor for about a year now, just short of a year. He's worked with us, advised us, gave us some positive suggestions as to how to carry on through the pandemic, and I truly appreciate his compassion. As a doctor, as a person, I am totally amazed by his stamina. He's go, go, go. I've been at a few meetings with others, but the doctor has been. I wonder how it is to live such a busy life in these times. And I mean it, very sincerely from the bottom of my heart. I've been following you and your updates on a daily basis for 11 months now. And I thank you for that, and I will allow you to take it from here, Doctor.
Thank you, Chief. Thank you for having me here today. It's an honor, and thank you for your remarks. It's a privilege to listen to your words, and it makes it that much more important coming from the great leader you are. Thank you. I'm glad to be of service. This pandemic is a pandemic of the highest caliber, the likes of which we haven't seen for the past 100 years. The Spanish flu was the other one. And reflecting over the past 10, 11 months, the collaboration with the leadership in the community, the council, has been optimal, and the results with the very low number of cases in the community is a clear indication of the success the community has achieved. Now with the vaccine in arms, it's the first nail that we're putting in the coffin of this pandemic, and hopefully the last nail will be very soon. We have confirmation of 2 shipments in February, 3,000 in a week of February 15th, and the second shipment is 4,000 in a week of February 22nd. Those will cover the healthcare workers in Grey Bruce, the indigenous community, any adult who wants the vaccine will be receiving the vaccine, EMS, and retirement homes in Grey Bruce. So by the end of February, we can ensure that the first dose has been received by anybody who needs it in the community, any adult I should mention, just because the vaccine is approved for 18 plus. And again, we look forward to the second dose, and that should be the end of any potential suffering of this pandemic in the community.
Thank you, Doctor. I think we can mention that the first round of vaccinations went to the Madoki residents because it was elders and others living in the same bubble. So we addressed that situation first. This latest round, which is today, February the 9th, we've had, I believe, 35 vaccinations come into the community, and we're addressing the 85 and over group, and also community members who have compromised health conditions. We've also worked with one of our counselors, Nick Saunders, who sits on a committee with others to work out the logistics before the vaccine comes into the community, and we try to make it as, I guess, fair or reasonable as possible to make sure those most at risk get the vaccine first, and I'm sure the community appreciates that. Again, I always have to thank the community for their patience, because this isn't an easy thing going through 10 months, 11 months of a pandemic, waiting for that magical vaccination to come. And it's not a local pandemic, it's a world pandemic. And we have to realize that, you know, we do our best to get in queue to have our community addressed.
You referenced, Chief, the stamina to do more, and truly, like today, we have already completed the vaccination of the 30 residents who are more at risk, and my brain is already into the next step, who's in the community, and that's where, in my update, I provided that. Thank you for mentioning the vaccines that took place today, and it's quite empowering to see everybody working together to ensure this happens.
And I do believe we have another guest in the community today. And as I had said, we have another special guest in the community who I've just met probably 30 minutes ago.
30 minutes ago.
And I'm not a great one with names, so I will let you introduce yourself.
Thank you, Chief. My name is Dr. Reem Zayed. I am a public health physician, just joined the Grey Bruce Health Unit as of yesterday. It's a great honor to work with Dr. Ian Arra, the medical health officer in Grey Bruce, and it's a great honor and privilege for me. So for the first visit for me as a field visit, to know the community here, is to come here to the center, the community center, and I have a great ties and experience working before in northern Saskatchewan with the indigenous community there, and it has been really a privilege. So I'm really glad for that my first visit in the community here is to be with the chief and the center here, and I'm impressed about that everything is going well, and people are keeping safe and following the preventive measures. And I hope, as Dr. Arra said, and the chief also said about that we are almost there, and I hope you will keep safe and hanging there, as with the vaccine, hopefully things will come to an end by this summer, hopefully.
And all I can express is that, you know, we're doing our best. We're to get a hold of the vaccine and allow community members to be inoculated with this vaccine. And it does, a lot of times, it creates a certain degree of frustration, but it also, we have to be resolute and continue to be patient and continue to practice the things that will keep us safe. I mean, that's, we do it for others. We do it, we wear the masks and do the physical distancing to keep those that may be compromised as safe we possibly can. It's no easy chore, and I can say for a community to be in this for 11 months and still keep together and keep resolute on our determination, we're going to get through this. I can actually see the light at the end of the tunnel, but still we're going to have to carry on for another couple of months. I think we're going to call this a wrap, and to the community members, bear with us, be patient, We're almost there, Miigwech.